Hello everyone, welcome to Pediatrics by Dr. Anand. If my voice is audible to everyone, please put a message in the comment section. Thank you. Hello everyone, कैसे हैं आप सब लोग? What's happening in life? And if my voice is audible to everyone, please put a message in the comment section. Thank you. We're gonna start the class. A beautiful class on a beautiful topic, and the topic name is, what's the topic name? What is the topic name? The topic name is nothing but scurvy. मोती की तरह हमने notes बनाए हैं इसमें, and very beautifully we have made the notes. Let's start the class. People, everyone has come. Okay. Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform. My name is Dr. Anand. I'm MD Pediatrics. I have done my SRship from Lady Harding Medical College, Hindurao Medical College, and I'm here to present Pediatrics in a beautiful and a mind-blowing way. And yes, let's start off. In the Unacademy, now we have this amazing, mind-blowing NEET PG 2022 All India mock test, which is there on February 26th at 9 a.m. So compete yourself and test your preparation. Enroll now on this NEET PG 2022. Very beautifully in a proper pattern we have asked the questions, and we have video solutions also by the top educators. Like, it's mind-blowing. You must watch, like, must participate. In the Unacademy, we have something known as plus subscription and something known as iconic subscription. In the plus subscription, number one, you can watch me on your iOS, on your iPad, on your laptop, on your in your heart also you can watch me. And also in the plus subscription, we have all the access to our live and recorded classes. Every educator has done a very beautiful hard work also. This is the plus subscription. In the iconic subscription, you get the Unacademy platform and the prep ladder subscription. All the clinical notes, video lectures, question bank, rapid revision, treasure notes, everything you get on the Unacademy, like in the iconic subscription. Also, as you can see, that is how we have the plus subscription and the iconic subscription. Month wise it is divided. If the pack looks little expensive to you, then we have this wonderful code, because as MBBS students sometimes it becomes difficult to buy a pack, so it will be little financially it will be little beneficial for you if you use the code. And also, congratulations to someone who has worked really hard, our FMG toppers 2021. Now I want you all to be there on with the best of the best intention and best marks. Also, every educator is amazing. Every educator is very beautifully working hard to help you out, so you must watch every educator's program. If you're new to Unacademy platform, we have something known as special class, where amazingly we make a lot of polls to ask the MCQs. You never miss the classes because all the lectures are recorded. It's a very beautiful feature. And yes, I have my live session happening on 11th February 10 p.m. like study with me pediatric test series. Please finish this MCQ session, which is on 11th February 10 p.m. Participate, and if you participate, you get some amazing Amazon vouchers. In my last test also, so many people got 5,000 rupees Amazon vouchers. And yes, we have made the batches of Target Next 2023 subject wise batch, which we have made is amazing. And also, everyone knows that NEET PG now it's postponed to 21st May 2022. So we have this amazing revision classes, then self-study, then subject wise grand test, and then we have the solution discussion. So it will be helpful if you participate in that. Our new batches are Focus FMG 2022 and Focus FMG December 2022 comprehensive batch also. So that's it. This is the NEET PG Plus subscription. The duration are in front of you. These are the prices, and after discount we have the prices. Everyone is taking it, so you must avail. And that's it. This is the iconic bonanza offer, only from 11 to 16 February. You must jump and take it. And also this part is done. So let's start. Today's topic of choice is nothing but scurvy. Okay, hello Priya, Shubhangi, Savan, Ali, Zulfikar, nice name Zulfikar, and Zainab Akhtar, बड़े प्यारे प्यारे नाम हैं. Osama Sheikh, Savan Singh, Pancake, and Shubhangi Kaushik. Okay, Pancake says that what he called, sir, I think this is just for plus. Please confirm which. Okay, one second. Yeah. Which one? The test I'll confirm. Evening you had asked me. I went to gym and then I had no time, and that's what. So let's start the class. Now this is a very nice session. Very beautifully I have made the notes of scurvy. I want everyone to participate. दिमाग लगाइए थोड़ा सा. घुटने पे खारिश कीजिए, दिमाग एक्टिवेट होगा, ठीक है। और क्या कहते हैं, दैट्स व्हाट। सो लेट्स स्टार्ट द क्लास. This class, if you're a beginner also, it will be helpful. If you are someone like Pancake, who is a what you call PhD holder from London, then you also can participate and try to answer the questions. Before starting any classes, we always have a motivating quote, and today's motivating quote is nothing but: choose to let no thought of fear comes in the middle of your dreams. Very beautiful quote. Choose to let no thought of fear come in the middle of your dreams. My dream is my dream. I know it's hard. I know it's difficult. I know it's very painful, but it's worth it. By the end of the day, right now everything might look confusing to you. How will I get success in life? Oh my god, it's so difficult. I'm still stuck. I'm trying. Keep trying, because everything will make sense by the end of the journey. So please don't lose hope, and don't lose focus. Choose to let no thought of fear come in the middle of your dreams. With all the amazing positive intention, let's start the class. Scurvy. Okay, for scurvy, yes, scurvy, nothing but we all know that we will be talking about vitamin C. In this whole scenario, we're going to talk about a lot of amazing questions, a very beautiful topic, and some roughly around 18-20 MCQs are there in this topic. So start with scurvy, or you need to know the vitamin C, right? Vitamin C. So scurvy will be divided into the subheadings are: introduction, active form of the vitamin C, how does vitamin C absorbs in my body, how does it get excreted, its function, the sources of vitamin C, the recommended dietary allowance of vitamin C, deficiency of vitamin C causes what are the clinical features, and what is the management. Okay, दैट इज़ हाउ मोती की तरह हम पढ़ेंगे, मस्त तरीके से, बहुत ही बढ़िया नोट्स हैं, मज़ा आएगा। बस दिमाग को खुला रखें, एक चेहरे पे हल्की स्माइल रखें, पेन और पेंसिल लेके रखें, थोड़ा जो भी इंपॉर्टेंट पॉइंट्स लगे उनको नोट कर लें, और इफ़ यू हैव एनी डाउट यू कैन आस्क मी एनी टाइम. Let's start. Vitamin C. Oh, this cutie baby is thinking like this. So yes, this vitamin C which we are talking about, can anyone help me and tell me, this vitamin C, is it a fat soluble vitamin or a water soluble vitamin? This cutie pie baby, like pancake and sawan. So from this side it looks like a pancake, and from this side it looks like sawan. So what do you think? Can anyone help me with the answer? Is this a fat soluble vitamin or a water soluble vitamin? What do you think? Yes, we have people who are answering so nicely. True, it is a water soluble vitamin, right? So the first question, vitamin C, is it fat soluble or water soluble? Everyone knows it is what you call water soluble. Beautiful. Okay, pancakes. Sir is ignoring me. Where I'm ignoring you, dude? Pancake, I wrote your name and you're saying I'm ignoring you. Hello, please open your eyes. Next important question, fat soluble vitamin. Can anyone name some fat soluble vitamins to me? Very important. I think everyone knows about it. Dr. Sawan, Dr. Hemal, and Dr. Sawan Singh again. Yes. So yes, fat soluble vitamin is nothing but vitamin A, D, E, K are fat soluble vitamin. Vitamin A, vitamin D, vitamin E, and vitamin K. So two questions we have covered. Vitamin C, is this fat soluble vitamin or a water soluble vitamin? It is water soluble vitamin, and fat soluble vitamins are A, D, E, K. Next question. Yes, vitamin C, basically vitamin C, it is a strong reducing agent. प्लीज ओपन योर माइंड, अपने दिमाग की बत्ती को थोड़ा सा खोलें, एक चेहरे पे मुस्कान रखें और समझें दैट विटामिन सी बेसिकली इट इज अ स्ट्रॉन्ग रिड्यूसिंग एजेंट. सर वो क्या होता है? सर आई हैव नेवर हर्ड दिस नेम सर, रिड्यूसिंग एजेंट. सर व्हाट इज द स्ट्रॉन्ग रिड्यूसिंग एजेंट? सो व्हाट इज रिड्यूसिंग एजेंट? सी, अ सब्सटेंस दैट टेंड्स टू ब्रिंग about reduction by being oxidized and by losing electrons. Again, I'm repeating, vitamin C is a strong reducing agent. Reducing agent means a substance that tends to bring about reduction, reducing agent, right? It tends to bring about reduction by being oxidized and by losing electrons. So it is a strong reducing agent. Anyone who's a topper in biochemistry can feel this line. The vitamin C is a strong reducing agent. Okay, that's it. Number one, yes, this is a very good question. Which form of vitamin C is the most stable? So what do you think? Is the liquid form more stable? Is the syrup vitamin C more stable? Is the tablet vitamin C more stable? Dried form is more stable? Which is the most stable form of vitamin C? So see this, I have made this presentation. If you're a newcomer, you will understand. If you are revising this topic, then you must answer before me mentioning the answer. इससे समझ में आ जाएगा कि तुमने सच में पढ़ा है या ऊपर से बस ऐसे ही वो करा है करके. ओके ओके ओके, क्या बातें क्या हो रही हैं? हाँ जी ठीक है, वेरी गुड. एक तो चैटिंग भी पूरी पढ़नी पड़ती है मुझे कि कौन क्या कहानियाँ पा रहा है. पैनकेक 20, अच्छा ठीक है. पैनकेक, लेट्स डिस्कस अबाउट विटामिन सी. 24 वीक्स हम बाद में पढ़ सकते हैं. सो येस, द बेस्ट आंसर इज विटामिन, द फॉर्म ऑफ विटामिन सी विच इज मोस्ट स्टेबल इज नथिंग बट ड्राइड फॉर्म and crystalline form. Dried form and the crystalline. See, देखो यहाँ लिखा हुआ है. Please look at this one. Can we see this dabba having vitamin C crystals, ascorbic acid? So this dried form or the crystalline form, okay, is the most stable form of vitamin C. ठीक है, समझ में आ गया everyone? Is everyone with me? Yes or no? Okay, I'll repeat again. We studied that vitamin C is a water soluble vitamin. We also studied that vitamin C is a very strong reducing agent basically. Then also we understood that the most stable form of vitamin C is the dried form or the crystalline form. ठीक है, I assume this much has gone inside your brains. Let's move further. Yes, very good. Vitamin C is formed from which sugar? It is a first year MBBS question. Anyone who is in first year MBBS can answer this question. Okay, so vitamin C is formed from which sugar? किस sugar से बनता है? Dr. Priya, Ganja, Pancake, Osama. Okay. Pancake, my question is vitamin C is formed from which sugar? It is a MCQ. It's a specific answer is there. Anyone who has read vitamin K? Okay, no problem. So vitamin C is formed from D-sorbitol. Star mark, PG entrance question. Okay, yes. Hint, you want hint is that my birthday is coming on 11th March. I'm planning to have a surprise for myself. That is the hint. Now tell me what is the answer. Vitamin C is formed from which sugar? The answer is D-sorbitol. Okay, done. Which is the most active form of vitamin C? Now who will tell? तभी मैंने ये question answer की form में बनाया है. That will tell your real point. Where are you at the level of vitamin C and scurvy? Who will tell me which is the active form of vitamin C? Very simple question. If I ask you which is the active form of vitamin D, who will tell me? Tell me which is the active form of vitamin D and what is the active form of vitamin C. Basics are so important. It is a first year MBBS question. Maybe I think it's a 12th class question. I don't know. Hanji, Nandu, yes. Okay, Pancake, you are mistaken, bro. The day you'll get to know, let my birthday come. Okay, so anyone, exactly. Julie Tiggity is very right. Which is the active form of vitamin C? The active form of vitamin C is L-ascorbic acid and dehydroascorbic acid. Very good, Julie. Very good. Julie is answering so well. And other people are answering are Nandu, Saf and Dr. Ganja. Very good. I don't know why I'm so excited. I should, I think, calm down and say in a very simple word. Which is the active form of vitamin C? L-ascorbic acid or dehydroascorbic acid. Okay, and which is the active form of vitamin D? Anyone? Which is the D? Exactly, Savan is so right. So cholecalciferol, right? Cholecalciferol, dihydroxycholecalciferol. So nothing but calcitriol. So yes, that active form of vitamin D is cholecalciferol and active form of vitamin C is L-ascorbic acid or dehydroascorbic acid. Okay, next question. Where vitamin C is absorbed? If you are a final year MBBS student, this must be a revision for you. So can anyone help me? There are so many students online. So कौन आंसर करेगा? मैं आंसर करूंगा. मैं तो नहीं कर रहा, मेरा मन नहीं है. कौन बताएगा? कहाँ होता है absorb? Kidney में, duodenum, jejunum, in my eyes, in your heart. Where vitamin C is absorbed? Who will tell me? Anyone? Pancake, Osama, Vanilla. Vanilla has come after so many days, na? That's nice. Okay. Anshu Pandey, so beautiful answering. Julie Tiggity, yes. Vitamin C is absorbed in our GIT and to be specific, distal small intestine. Vitamin C is absorbed in the distal small intestine. Okay. Duodenum. अच्छा क्यों? Duodenum क्यों? घर की बात है. तुम मोटे हो तो तुम duodenum में absorb कर लोगे सावन. It is in distal small intestine. Okay. the what reference Nelson. Okay, so again can we have a beautiful quiz contest. इस पे मैंने कम से कम 50 क्वेश्चंस बनाए हैं विटामिन सी पे, तो इट्स लाइक अ क्विज कॉन्टेस्ट. ओके, जिसमें पैनकेक पक्का हारती है. अगर ये स्पेशल क्लास हो रही है तो पैनकेक का नंबर आता है नीचे नीचे से नीचे वाला आता है ना पैनकेक. Okay, Zainab Akhtar says in our heart. That's true. So, can we revise? Are you with me? Yes or no? So, where vitamin C is absorbed? In my distal small intestine. What is the active form of vitamin C? L-ascorbic acid or dehydro ascorbic acid. What do you call vitamin C is formed from which sugar? D-sorbitol. Vitamin C, which form of vitamin C is most stable? Dried form, crystalline form. समझ में आ रहा नहीं आ रहा? Okay, done. So, and also one very important thing, the absorption of vitamin C occurs in dose dependent manner. This is one special point we need to understand. Absorption of vitamin C occurs in dose dependent manner. The more you give, less will be the absorption. The more vitamin C you will give, less will be the absorption. Just remember, it is in a dose dependent manner. The absorption, the more you give, the less will be absorbed. ठीक है, डन. पैनकेक इज सेइंग टू सावन सिंह टमी बड़ा हंसी आ रहा है. ठीक है, ओके, क्यूट, नाइस. ठीक है, आगे बढ़े. डन. ओके, यस. अच्छा, क्या, हाँ, ओके. Vitamin C, if kept unabsorbed in my intestine, it will cause what? Who will tell me? It's a MCQ session. It's a quiz contest. We have a quiz contest, everyone, on vitamin C and scurvy. Tell me the answer. Vitamin C, if kept unabsorbed in my intestine, can it cause some problem? Yes or no? Who will tell me the answer? मैं तो नहीं बताऊंगा. Pancake will say, can you give some hint, sir? Please, sir, give me some hint. I don't have hint. Tell me the answer. anyone and give options. हाँ जी, options दें तुमको, तो तुम option दो पहले, मैं तुम्हें option देता हूँ. option नहीं है bro, tell me the answer. anyone? Okay, bloating no, constipation no, scurvy no. So osmotic diarrhea, remember vitamin C, if it's unabsorbed in my intestine for a long time, it can cause me osmotic diarrhea. That, okay, please remember, it's very important. ये बहुत ही amazing MCQs है. You can take a class, being a final year MBBS student, you can take a class for the first year MBBS. Scurvy, such a simple topic, but there are a million questions which we still don't know. Okay, so remember this one. Acha, osmotic diarrhea, please remember. I don't know why my blood pressure goes very high while teaching. Vitamin C, if kept unabsorbed in my intestine, it can cause osmotic diarrhea. Okay, what are the various types of diarrhea? Pancake, what are the types of diarrhea? Just a random question. Other than osmotic diarrhea, do we know any other types of diarrhea? Vanilla, Osama, Savan Singh, अंशु पांडे, डॉक्टर गांजा. हाँ, बातें करा लो, बातें जितनी मर्जी. टाइप्स ऑफ डायरिया है तो चक्कर खा के ऐसे, ये तो कभी पढ़ा ही नहीं था, ऐसे सुनना. बताओ क्या आंसर है इसका. हाँ जी, वेरी गुड वेरी गुड. या, सो वी हैव ऑस्मोटिक डायरिया, वी हैव सिक्रीटरी डायरिया. हैव यू हर्ड ऑफ एक्यूट डायरिया? हैव यू हर्ड ऑफ व्हाट यू कॉल्ड persistent डायरिया? हैव यू हर्ड ऑफ chronic डायरिया? Have you heard of antibiotic associated diarrhea? Antibiotic associated diarrhea. Have you heard of traveler's diarrhea? Traveler's diarrhea. Have you heard of osmotic diarrhea? Have you heard of secretory diarrhea? Have you heard of parenteral diarrhea? Parenteral diarrhea. These are the various types of diarrhea. If anyone giving next exam and if I become the external examiner, बेटा तुम आओ, फिर तो मैं तुम्हारी क्लास लूंगा. ये जो सारे बातें मार रहे हैं, अंशु पांडे, सावन सिंह, जूली, तुम्हारे, आई विल बी द एक्सटर्नल एग्जामिनर. फिर देखते हैं क्या होता है. तो वेरियस टाइप्स ऑफ डायरिया आर, ब्रो, रिमेंबर, एक्यूट डायरिया, persistent डायरिया, chronic डायरिया, एंटीबायोटिक एसोसिएटेड डायरिया, ट्रैवलर्स डायरिया, ऑस्मोटिक डायरिया, सिक्रीटरी डायरिया, पारेंटल डायरिया. ठीक है, दैट यू शुड नो. ठीक है, हाँ, एग्जैक्टली. सावन सिंह इज ब्यूटिफुली आंसरिंग. ट्रैवलर्स डायरिया इज बिकॉज ऑफ व्हाट? अनदर एग्जाम क्वेश्चन. ट्रैवलर्स डायरिया इज बिकॉज ऑफ enterotoxigenic strain of E. coli. ETEC, enterotoxigenic strain of E. coli causes traveler's diarrhea. Which is the most common antibiotic causing diarrhea? ठीक है, सावन says आप प्लीज बन जाओ एक्सटर्नल एग्जामिनर मेरे. हाँ बेटे, तेरे को तो मैं ऐसा, तेरा मैं केस प्रेजेंटेशन लूंगा, पानी पानी, फिर तो बोलेगा पानी पानी हो गए, लाइक दैट यू विल से. ओके, विच इज द मोस्ट कॉमन एंटीबायोटिक कॉजिंग डायरिया? एनीवन? विच इज द मोस्ट कॉमन एंटीबायोटिक कॉजिंग डायरिया? इस सवाल का जवाब दे सकते हैं सावन सिंह, ओसामा, जूली टिकड़ी एंड या अंशु पांडे इज वेरी गुड राइट. Amoxicillin. Amoxicillin is the most common antibiotic causing diarrhea. Any patient, as far as pediatricians are concerned, counseling plays a very important role. For LRTI, if you give a patient amoxicillin, in the evening, the patient attendant will come to you and start shouting, "What kind of doctor do you are? For cough and cold, you gave my child amoxicillin, but he started passing loose stool." So, are you understanding? Because the antibiotic associated diarrhea, the amoxicillin basically can cause diarrhea. So as far as pediatrician, you will tell the attendant, tell the mother that, "Madam, this drug which I am giving to you, amoxicillin, can cause diarrhea in your child." So अगर बच्चा अगर potty करता है loose, तो घबराने वाली बात नहीं है. Don't worry, I'll give you a zinc, or maybe I'll give you a probiotic or ORS, and don't worry, the baby might have diarrhea, and in the evening baby will have diarrhea, and that mother will tell to her husband, "नहीं नहीं, doctor ने कहा था, Dr. Pancake told me that it can have diarrhea can happen." Very good, doctor, she told me already that, "Madam, diarrhea can happen." Is everyone understanding? Yes or yes? You can give a golden heart or a black heart or a purple heart or a magenta heart. उसके बाद ही हम आगे बढ़ेंगे. समझ में आ रहा है कि नहीं? पेंटोप्रोजोल ब्रो, पेंटोप्रोजोल नहीं देंगे ना डियर, डायरिया हो रहा है, हम बच्चों में ORS या जिंक का देते हैं, जिंक देते हैं. ठीक है, समझ में आ रहा है? डॉक्टर ताराकांता, डॉक्टर गांजा, साइदा नसरीन, वनीला, ओसामा, हिमाल एंड आवर व्हाट यू कॉल्ड पैनकेक. ठीक है, डन. चलो आगे बढ़ते हैं. शुरू करो अंताक्षरी लेके प्रभु का नाम, बोलो राम राम राम. मेरे पे आया, मैं शुरू करता हूँ. ठीक है. Okay, how vitamin C is excreted? Okay, who will tell me the answer? हाँ जी, Dr. Saida Nasreen. How what you called vitamin C is excreted? How? By the stool, by the urine, by what? Anyone? Ashutosh, what do you think, bro? How vitamin C is excreted? Exactly. Now Savan sees. See, you need to tell the examiner what he wants to hear. नहीं सर किडनी, सर इधर से उधर से ऐसे आंखें मचलने की जरूरत नहीं है. Vitamin C is excreted by my urine. It is excreted by urine. हाँ, अब बहुत लोग बहुत ही प्यारे और बहुत तमीज़ के आंसर दे रहे हैं. बहुत ही बढ़िया, आपकी रैंक 1 आ सकती है. वेरी गुड. Next question. Functions of vitamin C. So let's have a quick revision. I hope we are getting it. Exactly. So very beautifully we are covering the topic. We covered number 1, vitamin C is a water soluble vitamin. This baby is so cute. This baby is so cute. I like it. बच्चा बड़ा क्यूट लग रहा है. ओके हाँ, चलो जोक्स अपार्ट. सो विटामिन सी इज अ वाटर soluble vitamin. Vitamin C is a very strong reducing agent. That means, like, a substance that tends to bring about reduction by being oxidized or by losing electrons. And also we understood the most stable form of vitamin C is the dried form. Also we wonderfully understood that vitamin C is formed from D-sorbitol से बनता है. And also the most active form of vitamin C is L-ascorbic acid or dehydroascorbic acid, and most active form of vitamin D is 125 dihydroxycholecalciferol or calcitriol. Vitamin C is absorbed in my distal small intestine and in a dose dependent manner. Then also we understood that vitamin C, if kept unabsorbed in my intestine, it can cause osmotic diarrhea, and vitamin C is excreted by my urine. ठीक है, very good. अच्छा, Savan Singh says vitamin C also available in face wash nowadays. Face wash, बस face wash करा लो तुम, face wash use करो तुम. Who uses face wash? Don't use face wash. Just दिन में 3 से 4 बार आप नॉर्मल पानी से मुंह धोएं अपना, चेहरा आपका सोन परी की तरह निकल आएगा. ठीक है, बस कोई ज़रूरत नहीं है वो करने की. Functions of vitamin C. Exactly. Julie wonderfully answering. Wound healing, very true, very nice. Okay, helping of wound healing, very true. What are the other what are the other functions of vitamin C? Very, very important. The first function. See, this is a very beautiful class. Let's just finish it off in a like, if you've done this topic like this, no, you have done PhD in vitamin C. Okay. So the first important function of vitamin C is nothing but collagen formation. हड्डी बनाने में मदद करता है. हड्डी मजबूती. Vitamin C is very good in healing, wound healing. Vitamin C is very good. Okay. someone having a bruise or a trauma and this and that, tell him to have a lot of vitamin C and B complex also. But vitamin C is very good for collagen formation. For collagen formation, number one. Number two, of course, it helps in formation of chondroitin sulfate. Please read this, okay? देखो लिखा है यहाँ पे, chondroitin sulfate helps in, देखो बहुत अच्छा लिखा है, joint mobility and comfort, tissue elasticity. Okay, so it's so nice. See, it's a self, it's written. Okay, it's good for wound healing. So what did we understand? Pancake कहाँ गई? Pancake, you're there online. अच्छा, Pancake is typing something. अच्छा, post-translational hydroxylation of lysine and proline amino acid. Hi-fi words, I ignore hi-fi words. So the first important function is collagen formation. It helps in formation of chondroitin sulfate, and also it helps in a hydroxylation reaction. Okay, now very important, after the one very, see again, what is the take home message of vitamin C function mein? The function of vitamin C is collagen formation, bone formation. Okay, now I have a question here. Why low birth weight babies can lead to hypertyrosinemia? Why low birth weight babies will lead to hypertyrosinemia? It has some touch with vitamin C also. So Pancake, if you are the, what you called, if I am the external examiner and we are giving next right now, you are the student final year who is shaking, sir, I have not read anything, sir, I have got headache, sir, this and the drama. If you do, tell me why low birth weight babies can lead to hypertyrosinemia. Any random guess? Pancake, LA, Kanja, Ali Zulfikar, Julie, Nandu, Zafir, Faraz, Prakash and 1000 more people. क्यों? मैं नहीं बताऊंगा आंसर, खुद बताओ. Okay, Savan says vitamin C does something with tyrosin. बस, बहुत अच्छे आंसर. तुम्हें इधर आओ, तुम इधर आओ. Very nice, huh? Very nice answer. Please come after 6 months. Thank you. You can come after 6 months. Very beautiful answer. So nice. This very talented boy. This is. सही आंसर क्या है इसका? So the answer is, remember, low birth weight babies. Low birth weight babies is less than 2.5 kg. Less than 2.5 is low birth weight babies, right? Yeah. So the more the baby is low birth weight, always remember, for the low birth weight babies we give high protein diet. For the low birth weight babies में हमेशा high protein diet देना होता है. Remember, for the low birth weight babies we always give a high protein diet क्योंकि उनकी requirement ज़्यादा होती है. The normal requirement for protein for a term baby, the normal requirement of protein for a term baby is 1 to 2 gram per kg per day, whereas for the preterm baby is nothing but 2 to 3 gram per kg per day. I'll repeat again. What are we studying? We are studying that more the baby is low birth weight, we have to give a high protein diet. ठीक है? तो क्या हो गया सर? दे दिया हमने high protein diet. High proteins. High protein means high amino acids. High proteins means high amino acids. And high amino acid means which all amino acids? So tyrosin is nothing but like a group of amino acids. Okay, tyrosin, and that's what they form the protein. So means more the baby is low birth weight, more the baby needs a high protein diet. More high protein diet you will give means more group of amino acids. Protein मतलब amino acids means nothing but tyrosin, and that leads to transient hypertyrosinemia. That is the answer for this question. Why only tyrosin? मतलब होता है, सब कुछ बढ़ता है लेकिन टायरोसिन ज्यादा बढ़ता है, इतना बस पता होना चाहिए. ठीक है? More the baby is low birth weight, more its high protein requirement is there, and when the more high protein means high amino acids, and which amino acid, like the tyrosin is like plays a very important role here, and that leads to transient hypertyrosinemia. So that's what. And so now function of vitamin C is that vitamin C metabolizes tyrosin. Vitamin C metabolizes tyrosin. So यहाँ पर भी this is one important function after the collagen formation. The second function of vitamin C is nothing but vitamin C metabolizes tyrosin. Okay, next point, it metabolizes tyrosin. It's a function. Okay, so again, what did we study? What are we studying? What is the take home message? Number one, vitamin C helps in collagen formation. I'm telling you everyone, learn, revise, here only finish. Once we finish this class, I want everything in your brains. Tell your brains, I know it, I remember. Vitamin C, okay. हड्डी मेरी देखो 15.5 इंच के बाइसेप्स, 15.5 नहीं 15 है अभी तो, 15.5 भी अगले महीने तक हो जाएंगे. तो 15-inch biceps helps in collagen, bone formation, collagen formation, okay. And that's what. And also very important, it metabolizes tyrosine. And yeah, so vitamin C is used in hypertyrosinemia. Yes. And wound healing, very next, very important, as everyone, Julie was telling and every beautiful people was telling that vitamin C helps in wound healing. ठीक है, ये रटने वाली बात नहीं, in general हमको पता होना चाहिए. Also, yes, again very important function of vitamin C, it helps in conversion of folic acid from one form to another. It helps in conversion of what you called yeah, what are you saying? Always appreciate your barber. Pancake, sir, appreciate him. He's saying since so long. Appreciate whom, Pancake? I don't understand what you're saying. So, vitamin C helps in conversion of folic acid from one form to another. Therefore, very important, again, PG entrance question, true or false? Vitamin C deficiency, can it lead to megaloblastic anemia? The answer is yes. Vitamin C deficiency can lead to megaloblastic anemia. Acha, okay. So vitamin C deficiency can lead to megaloblastic anemia because vitamin C helps in conversion of folic acid from one form to another. ठीक है, please put inside in your tiny head. It's important. जब ये क्वेश्चन आएगा ना एग्जाम में, नहीं मेगलोब्लास्टिक क्यों करनी, इसमें तो हेल्प ही नहीं होता, ऐसे करके जवाब दोगे तुम. ठीक है, सो vitamin C deficiency can lead to megaloblastic anemia. Okay, and of course megaloblastic anemia, you will have a macrocytic picture. Okay, let me ask you macrocytic. So what is the normal mean corpuscular volume? Please, what do you call it? हाँ जी, Pancake, ओसामा, सावन, बातें देखो. हाँ जी ओसामा, व्हाट इज द नॉर्मल मीन कॉर्पस्कुलर वॉल्यूम? जब तक सवाल ना पूछो ना, तब चक्कर नहीं आता तुमको. हाँ जी, नॉर्मल कितना होता है? वेरी गुड, 80 to 100. क्या 80 to 100? क्या ऑप्शंस आर? परसेंटेज, पिकोग्राम, व्हाट इज द नॉर्मल एमसीवी? यूनिट कौन बताएगा? यूनिट मैं बताऊंगा. ऑस्कर से पूछ रहा हूँ. ऑस्कर, एमसीवी की नॉर्मल यूनिट क्या होता है? ऑस्कर नहीं बता रहा अभी, कौन बताएगा? एग्जैक्टली, फेम्टोलीटर. ठीक है, वेरी गुड, फेम्टोलीटर, वेरी ट्रू. व्हाट इज द नॉर्मल एमसीएच, मीन कॉर्पस्कुलर हीमोग्लोबिन कितना होता है? मीन कॉर्पस्कुलर अच्छा सावन देखो, फेम्टोमीटर. वाह, फेम्टोमीटर, वाह, क्या बात. फेम्टोलीटर होता है, मीटर नहीं, femtoliter. Okay, and what's the normal mean corpuscular hemoglobin? 30 plus minus 2 or plus minus 3 unit. What is the unit of mean corpuscular hemoglobin? Exactly, it is picogram. Okay, and what is the normal mean corpuscular hemoglobin concentration? Again 30 plus minus 3 percentage. Okay, ठीक है, done. I assume that we all are able to understand the topic. And also vitamin C helps in increases the absorption of iron. Vitamin C increases the absorption of iron, that also you should know. ठीक है, and vitamin C is a strong reducing agent, we all know that. And also, you know, vitamin C helps in the decrease in the toxicity of selenium, lead, cadmium and nickel. Okay, so everything. So can we appreciate that vitamin C is a very beautiful vitamin? Vitamin C का बहुत ज़्यादा रोल है. vitamin C की गोलियां ना खाएं, vitamin C के पदार्थ को आप एज्यूम कह रहा हूँ, कंज्यूम करें. ठीक है, डन, अंडरस्टूड. एंड ये तो पता ही होगा सबको. डेफिशिएंसी ऑफ सेलेनियम कैन लीड टू विच डिजीज? Okay, अच्छा, pancake selling. So remember, like 27 to 33, 27, 33, 37. 27, 33 is MCH, 33 to 37 is MCHC. Okay, nice. So हाँ, I know टैबलेट लिम्सी आती है. वेरी ट्रू, पैनकेक इज राइट. मेरी एक बहुत अच्छी जूनियर है ग्रेस, वो लाती थी, बड़ी सुंदर सी इतनी बड़ी डब्बी आती है और इतना मीठा होता है, उसको पानी मिलाओ ऐसे पी जाओ. हम नाइट ड्यूटी में पीते थे, इतना टेस्टी. मैंने कहा डूड यू शुड गेट एवरी टाइम, यू शुड गेट इन द नाइट ड्यूटी. हाँ जी, एग्जैक्टली. केशान डिजीज, सेलेनियम डेफिशिएंसी कैन लीड टू केशान डिजीज. एंड विच इज द मोस्ट कॉमन कंजेनाइटल हार्ट डिजीज इन केशान डिजीज? डॉक्टर गांजा, अतमेश, नाइस नेम, सरनेम अतमेश, Ajit Kumar, Osama, Savan, Prakash, and million other people. Hemal, the most common congenital heart disease in Keshan disease is? Who will tell me? I will not tell you. Most common congenital heart disease in Keshan disease is what? मुझे नहीं पता, कौन बताएगा? एनीवन, एनीवन? मैं नहीं बताने वाला आंसर, कौन बताएगा? एग्जैक्टली, वेरी गुड, डायलेटेड कार्डियोमायोपैथी, DCM। मोस्ट कॉमन कंजेनिटल हार्ट indication disease is dilated cardiomyopathy. Most common congenital heart disease in indication disease is dilated cardiomyopathy. Which is the most common congenital heart disease in Marfan syndrome? Which is the most common congenital heart disease in Marfan syndrome? Very good. The most common congenital heart disease in Marfan syndrome is mitral valve prolapse, and most common cause of death in Marfan syndrome is aortic dissection. Aortic dissection. I'll repeat again. M for Marfan syndrome, M for MVP. The most common congenital heart disease in Marfan syndrome is mitral valve prolapse, and most common cause of death in Marfan syndrome is aortic dissection. Okay, I have a question to Pancake. Pancake, tell me one thing. A girl of Marfan syndrome has come to you. Her mother says she's very good in sports. The mother says she's very good in sports. She always get rank one. She's very good in running. Her mother is so proud of her daughter that she say that she always get rank one. And Marfan syndrome she's diagnosed with, and she's very good with sports. And she has her sports competition. So Pancake, what will you advise? What advice would you like to give to a patient of Marfan who is very good in sports, who is all India rank one in sports? She is planning to get a sports quota admission and in MBBS. So, what do you advise to this patient? Hanji, Julie, Nandi, no, 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 exactly. Okay, not allowed. Don't. हिमाल कितने प्यार से कह रहा है, डोंट स्ट्रेस ऑन हार्ट, लीव द स्पोर्ट. नाइस touch, good sensitive touch. Julie says to do sports, huh? No. Okay. She, exactly. Yes, that's the right answer. Everyone is beautifully right. Dr. Saida Nasreen, very good. So a Marfan syndrome patient should never go to sports. Why? They can very prone to fracture. They because they usually have joint laxity basically, and they can prone to fracture. What was the exact word? Yeah, they can exhaust very soon. They can have exhaust. They will get exhaust very soon. Their joints are very flexible, but they can go to fracture. Okay, so you should never. ठीक है. Okay, Julie, done, finish. And also vitamin C helps in interferon production. Also interferon production. It's an antioxidant property also is there in the vitamin C. That finishes the first half. Of the vitamin C, where we covered the important functions of vitamin C, how it is metabolized, how it is excreted, how it is absorbed, which is the most active form, and this and that. Let's continue further. And before continuing again, a motivating quote. Scar tissue, it's a very nice word. Scar tissue is stronger than the regular tissue. Scar tissue is stronger than the regular tissue. Realize your strength and move on. कितनी सच्ची बात है, मतलब it's such a simple but yet so strong, so strong quote, right? If scar tissue in your body, it's in your body itself, like we have a regular tissue and we have a scar tissue. Scar tissue is always stronger than the regular tissue. So people who have pain in their life, people who have stress in their life, people who have gone to worst phase of life, people who have gone through depression and come out of it, people who have gone to the most sad phase of their life and move on. So what are all these things? This pain, stress, worst situation, depression, sadness, what is this? That will lead to scar in your body, but scar tissue is always stronger than the regular tissue. So realize your strength and move on in life. Okay, yes, exactly. Let's move further. Yes, beautiful. So what are the ओके वेट, पहले तो मैं जवाब दे दूं पहले लोगों के. ओसामा शेख सेज vitamin C deficiency can cause pseudo paralysis in limb. Yes buddy, definitely it can cause pseudo paralysis in limb. Vitamin C is one of the very important differential diagnosis of AFP. What is AFP? Anyone? What is AFP? AFP is exactly acute flaccid paralysis. AFP is acute flaccid paralysis. Anyone? अच्छा, सारे आंसर मैं ही बता रहा हूँ, मैं नहीं बताऊंगा अब. हाँ जी, what are the differential diagnosis of acute flaccid paralysis? Anyone? Pancake, ओसामा. अच्छा, लो जी, ये देखो नेगेटिव लोग यहाँ बाकी अलग प्रकार के लोग भी हैं हमारे ग्रुप में. Pancake says scar tissue is not stronger after surgery. Thank you for telling. Thank you, that's very sweet of you. But scar tissue wins. That's all you know. ठीक है, हाँ जी, वेरी गुड, वेरी गुड, जूली नाउ इज आंसरिंग ब्यूटीफुल। हाँ जी, द डिफरेंशियल डायग्नोसिस ऑफ एक्यूट फ्लैसिड पैरालिसिस इज नथिंग बट गुलियन बारे सिंड्रोम, गुलियन बारे syndrome, transverse myelitis, transverse myelitis, traumatic neuritis, traumatic neuritis, and anything else? Yes, diphtheria, very important. Diphtheria, very good, and also scurvy. स्कर्वी पेशेंट हम आगे, ओसामा, हम आगे आने वाली स्लाइड्स में पढ़ने वाले थे, मैं बता देता हूँ कि स्कर्वी पेशेंट्स, यू नो, दे हैव सो मच ऑफ व्हाट यू कॉल्ड द स्कर्वी पेशेंट बिकॉज ऑफ दिस पेरियोस्टियल हेमरेज, दे हैव they have this bony tenderness and periosteal hemorrhage, so it's so excruciatingly painful, scurvy. The patient refuses to stand, the patient refuses to walk, and it looks like a case of acute flaccid paralysis. You give a painkiller, you give vitamin C to the patient starts running. So that's how you differentiate the pseudo paralysis of scurvy from the acute flaccid paralysis. Okay, ठीक है, डन, आगे बढ़े। अच्छा, और एक चीज और भी थी यहाँ पे, हाँ जी, विच वन कॉजेज असेंडिंग पैरालिसिस, विच वन कॉजेज डिसेंडिंग पैरालिसिस? इफ आई टॉक अबाउट डिप्थीरिया, does see you know, right, in we have something known as ascending paralysis and descending paralysis. This ascending paralysis में नीचे से ऊपर weakness and then ऊपर से नीचे weakness. So diphtheria causes what? Diphtheria causes descending paralysis, or diphtheria causes ascending paralysis. Means, will the patient will have weakness starting from the lower limbs then upper limbs, or the patient will have a weakness from the upper limbs to the lower limbs? So who will tell me? Exactly. Very good. So D said diphtheria, D said descending. D said diphtheria, D said descending. So the diphtheria patient usually have descending paralysis. Descending paralysis. And Guillain-Barré syndrome? You sure, Atmesh, Guillain-Barré syndrome has descending paralysis? What about Guillain-Barré syndrome, everyone? Exactly. Nasreen is right. Guillain-Barré syndrome will have ascending paralysis, whereas diphtheria patient will have what you call descending paralysis. That you should know. ठीक है, वेरी गुड, लेट्स मूव फर्दर। अच्छा, क्वेश्चन क्या था? सोर्सेज। नाउ कैन एनीवन टेल मी द सोर्सेज ऑफ विटामिन सी? पैनकेक, मैं क्या खाऊं ऐसा बताइए डॉक्टर साहब कि मुझे विटामिन सी मिल जाए। धूप में बैठूं, मैं धूप में बैठूं? हाँ जी, कौन बताएगा? हाँ जी, क्या खाएं ऐसा? व्हाट टू ईट? डॉक्टर, डॉक्टर पैनकेक, डॉक्टर सावन, आई वांट विटामिन सी, आई वांट विटामिन सी, व्हाट शुड आई ईट? I don't have money to buy a Limsi tablet. Can you tell me exactly? Very good. Very. किसने बोला आमला? Yes, Dr. Ganja. Dr. Ganja, very good. The one very, very important thing we have is citrus fruits. Citrus fruit. And this yellow orange color fruits. Number one, very important, amla. कौन आमला खाता है? Raise your hand. Please raise your hand if anyone have amla. Anyone? Raise your hand. Okay, हाँ जी, कौन खाता है आंवला? कोई खाता है आंवला में से? पोटैटो में ओके, इवन आई हैव सेड आंवला। हाँ जी, पैनकेक, वेरी गुड, द फर्स्ट आंसर वाज गिवन बाय दैट पर्सन, डियर, वेरी गुड। एवरी डे, इवन मी ऑल्सो, वी आर फ्रेंड्स, मैं भी रोज आंवला खाता हूँ। माई मॉम, शी ऑलवेज पैक्स वन आंवला in my this one. So very important, photographic memory, look at the picture and tell the diagnosis. So the most important, it's a treasure for vitamin C, amla. Then what is this? ये क्या दिख रहा है जो मीठा मीठा होता है, रोज खाते हैं, इसको खा के पेट में दर्द भी हो सकता है? ये क्या है? ये क्या है? गुड फॉर हेयर, थैंक्स ब्रो, गुड, थैंक गॉड आई हैव गुड हेयर। हाँ जी, हल्दी में डिप करके खाते हैं आंवले को? अच्छा, मुझे नहीं पता था। सो वेरी इंपॉर्टेंट, गुआवा। सो द इंपॉर्टेंट सोर्सेज ऑफ विटामिन सी आर आंवला, गुआवा। व्हाट इज दिस? ये क्या है जो मैं सावन की आंखों में डालूंगा? हाँ जी, ये क्या है? नींबू, ठीक है, नींबू, वेरी गुड, यस, गुआवा। जूली, यू आर वेरी गुड, यू आर आंसरिंग वेरी वेल, ब्रो, नॉट ब्रो, डूड। सो या, आंवला इज अ गुड सोर्स. Guava, please have a photographic picture in your mind. First picture was amla, second was guava, third was नींबू जो सावन की आंखों में जाएगा, ठीक है। देन क्या है ये? कौन खाएगा? हाथ खड़ा करो। मीठे 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 क्या है ये? आशुतोष, थैंक यू आशुतोष फॉर गिविंग हार्ट। हाँ जी, क्या है ये? क्या है ये? क्या है ये? कौन खाएगा? संतरे, संतरे कौन खाएगा? संतरे ले लो, 10 के दो, 10 के दो, 10 के दो, एग्जैक्टली, दैट्स ट्रू। और संतरे। ये क्या है? ये बड़ा अच्छा है, ये क्या है? ये पालक है, ये पुदीना है, ये मैं तो इतना कंफ्यूज होता हूँ। मतलब कोई तुम लोग को डू यू गेट कंफ्यूज इन धनिया एंड पुदीना? यस और नो? डज एनीवन गेट्स कंफ्यूज इन धनिया एंड पुदीना? एनी रैंडम गेसेस? अच्छा तेरे को बड़ा पता धनिया है ये। हाँ जी। Oh, hi-fi people also. Coriander. Okay. Julie says, try dry amla. It tastes good. Good dip in sugar. Dry amla, अच्छा. पता नहीं. My mom has only one amla. I don't know. She has a whole dabba, 1 kg of amla she's got. Dry वाला है या कैसे वाला है? थोड़ा wetty है. Dry वाला I will ask her once. मैंने dry नहीं खाया. हाँ जी. आशुतोष, yes bro. क्या है ये? अच्छा. So do you get confused in धनिया and पुदीना? Okay. ठीक है, मुरब्बा. गुड. So what is this? This is coriander. Coriander means धनिया. ठीक है, exactly, धनिया. So yes, and so धनिया also is a very good source of vitamin C. Again, can we revise? What are the good sources of vitamin C? Number one, this picture only telling so beautiful sources. Number one, citrus fruits, आंवला, guava, नींबू, lemon, orange, dhania, nothing but coriander. Okay, what is this? Drumstick? I did my UG from Bangalore, 5.5, 6 years there. Every day we used to have this rasam and sambar. Sambar में they you put very good drumsticks. It's very tasty, very proteinous. मोटे मोटे होते हैं drumsticks, ऐसे काट के देते हैं, बहुत टेस्टी होते हैं, बहुत टेस्टी drumstick is very good. मतलब मुझे तो बहुत अच्छे लगते हैं. ठीक है. Next, tomato, capsicum. अच्छा, who likes this capsicum? Who likes capsicum? Anyone? Do you like capsicum? Yes or no? Like if you order a veg platter somewhere, do you like capsicum or you don't like capsicum? Who likes capsicum? And वो कौन सा mushroom? Capsicum and mushroom. How many people likes or don't like? Mushroom को मैं नाक बना देता हूँ. ये आँखें होगी mushroom की. ये nice drawing. And oh, me too. I love capsicum. I like mushroom also. Which college, sir? I did from Ambedkar Medical College, Bangalore, AMC. Okay, Osama, he likes but not very much. Only capsicum. Hemal likes only capsicum. Okay, Ganja likes mushroom. Ashutosh says I use in cooking. भाई तुमने हमें तो कभी खिलाया नहीं. You use in cooking. When did you cook for us? You should get some chicken, mutton, something for us. We will also see whether it's right or not. So you like mushroom? Same. So I also like mushroom and I also like capsicum. So can we appreciate that tomato and capsicum is very rich in vitamin C? And yeah, now coming to the next question. Is bovine milk, भैंस, मोटी सी भैंस, सावन सावन खड़ा है यहाँ पे. सो इज bovine milk or the formula milk good source of vitamin C or a bad source of vitamin C? हाँ जी. Okay, Savan says I like it too much, especially with tandoori items. ओहो, हाई फाई पीपल, तंदूरी आइटम्स. और तुम्हारा तंदूर बनाए. ठीक है. मशरूम सूप मैंने मशरूम सूप पिया नहीं. मतलब आई लाइक, हाँ मशरूम अच्छा है, बट यहाँ कहाँ मिलता है दिल्ली में अच्छा मशरूम सूप? एग्जैक्टली, पैनकेक इज राइट. द्विवेदी अतमेश, क्या नाम है? द्विवेदी अतमेश. तुम्हारा नाम तो प्रोनाउंस करने में बड़ा प्रॉब्लम होती होगी. एंड यो किसी दादी को बताओ, आप बेटा आपका नाम क्या है? यू विल से द्विवेदी. दादी तो गई. लाइक द्विवेदी लाइक दैट. माय मॉम, माय ग्रैंडमदर्स हैव ऑलवेज हैव दिस प्रॉब्लम. अच्छा ठीक है. सो yes, the answer to this question very important. Is bovine or a formula milk good source of vitamin C? The answer is no. भैंस का दूध, गाय का दूध और किसी का भी दूध, मतलब formula milk is not a good source of vitamin C. It is a poor source of vitamin C. Remember that. Okay. And yeah, very good question. So let's see how many of us are what you called cook or cookie in our group. If someone loves to cook, then they should tell us the answer. कितना अच्छा लगता है ये Mickey Mouse types. So why do we sprinkle coriander on a cooked food? As we all know that coriander or धनिया ना, पुदीना, धनिया, coriander is a good source of vitamin C. तो तो डालो उसको फिर. After cooking, why do we sprinkle coriander? Why can't we just put coriander in the sabji itself? Anyone? कोई जो, अच्छा, सावन says I cook every day. If you cook every day, Mr. Cookie, please tell us. So question is, why do we sprinkle coriander on the cooked food? Why I can't? जो रात में चावल बना रहा हूँ या आलू गोभी बना रहे हैं तो उसमें डाल दो धनिया. ऊपर से क्यों स्प्रिंकल करते हैं वो क्यों? अच्छा, गांजा says olfaction satisfaction. That's sweet answer, but that's not the right answer. Okay, because it denatures in warm boiling water. Okay. So the best answer is that only coriander has vitamin C. Coriander has a very good amount of vitamin C, but vitamin C is lost by cooking. Vitamin C is lost by cooking. That's why after cooking we put this dhania. Okay, vitamin C is lost by cooking. Very good. Next question. Okay, what is the recommended dietary allowances of vitamin C? Pancake. What do you think? What do you called? Hanji. Uh, that's nice, bro. Pancake, ganja, LA, to look pretty and tempting. ये why do we cook? ये तो है to look pretty and tempting. Yeah, we sprinkle coriander, but remember coriander has vitamin C, and vitamin C is lost by cooking. That's why after cooking food, I will put dhania there. Okay, recommended dietary allowances for infants it is 25 mg per day. For infants it is 25 mg per day. For what you call older children it is 40 mg per day. छोटे बच्चों के लिए सावन की उम्र के बच्चों के लिए it is 25 mg per day. और ओसामा के बड़े बच्चों जैसे के लिए it is 40 mg per day. 40 mg per day. And for pregnancy and lactation it is 60 to 80 mg per day. So can we remember very importantly? So 25, 40 and 60 to 80. 25, 40, 60 to 80. 25 for savan. ओसामा के लिए it is 40 and pregnancy and lactation it is 60 to 80. ठीक है, डन. Okay, now coming to the next part, deficiency of vitamin C. ठीक है. What is IKR? I don't know what is IKR. अच्छा, and for me, for you, pancake, तुम कौन से उसमें आओगी? Okay, you also comes in infant only for me. So pancake and savan, for both pancake and savan, for infants basically, the recommended dietary allowances of vitamin C is 25 mg per day. So deficiency of vitamin C causes what? So the answer is it causes scurvy. It causes bleeding of gums. Yes, it causes bleeding of gums. Very important. Now we are entering into some difficult part. Now the topic will be little tongue twisting, little hi-fi words we're gonna use. So yes, it causes scurvy, the bleeding of gums, which is the most commonest age group. Now again, let's see how many of you have actually know the topic very well. Which is the most commonest age group of a child presenting with vitamin C? Can a newborn present with vitamin C, or it comes later in life? Which is the most commonest age group of vitamin C deficiency? The best answer, Shubhangi Kaushik, the best answer to this question nothing but roughly 6 months to 2 years. अच्छा 5 से 15 साल नहीं, थोड़ा सा उधर 6 महीने से 2 साल के बच्चे. A newborn can never present with vitamin C deficiency. It comes little later in life, 6 months to 2 years. Why, sir? Why so late? If I have vitamin C by birth, why will I not present with features? Why 6 months to 2 years is the commonest age group? Why so late? Because the collagen formation has a slow turnover. Collagen formation, which is the main function of vitamin C, collagen formation has a slow turnover. That is why basically you will see this little late presentation, because collagen formation has a slow turnover. Okay, vitamin C deficiency. So of course everyone know now let's end this topic. So of course, if I have vitamin C deficiency, the most commonest function is like collagen formation. So vitamin C deficiency means decrease collagen formation. My 15-inch biceps will go small. So decrease what you call collagen formation means decrease chondroitin sulfate, which is very important there, right? And that will lead to, so more, my bone will not be strong, right? My bone will not be strong, right? So that will lead to increased capillary permeability. Increase capillary permeability, or my bone will become very soft, very fragile and stuff like that. So increase capillary permeability, leading to very important point, subperiosteal hemorrhage. Subperiosteal hemorrhage. And this was a PG question. This one, ye wala, ye. Can we appreciate this? This is nothing but subperiosteal hemorrhage. Very important. Vitamin C deficiency can lead to subperiosteal hemorrhage because of decreased collagen formation, decreased chondroitin sulfate. Bone पक्की नहीं रहेगी, bone में bleeding होना शुरू हो जाएगा, leading to subperiosteal. This part again very important. ये देखो ये वाला, this is nothing but subperiosteal hemorrhage. समझ में आ गया? Yes or no? Done. Next point. And that can lead to petechiasis. That can lead to what you call ecchymosis. That can lead to you can say purpura. ठीक है, that can lead to any hematoma, yes or no? So naturally, once I start bleeding out, I can have these problems, right? Petechiae, ecchymosis, purpura, or hematoma. Now the question is, which one is the smallest, which one is the biggest? Is petechiae are the smallest? Like if there's a PG question, very very important, arrange these in ascending order, ascending, descending, छोटे से बड़ा, ठीक, छोटे से बड़ा क्या होता है? डिसेंडिंग, असेंडिंग, छोटे से बड़ा असेंडिंग। हाँ, अरेंज दीज इन असेंडिंग ऑर्डर। पेटिकेज इकाइमोसिस परप्यूरा हेमेटोमा, और इकाइमोसिस पेटिके हेमेटोमा परप्यूरा, और हेमेटोमा कम्स द स्मॉलेस्ट इज द हेमेटोमा। प्लीज अरेंज इन द असेंडिंग ऑर्डर। ये 4 ऑप्शन दिए हैं मैंने। इफ यू कैन आंसर दिस, यू आर वेरी गुड इन पीडियाट्रिक डर्मेटोलॉजी देन। सो व्हाट डू यू थिंक, सबसे छोटा कौन सा होता है, फिर बड़ा, फिर बड़ा, फिर बड़ा, फिर बड़ा कौन सा होता है? लेट्स सी इफ यू कैन आंसर। ओके, हिमाल सेज पेटिके परप्यूरा इकाइमोसिस। ओके, सावन सेज पेटिके परप्यूरा इकाइमोसिस। व्हाट अबाउट हेमेटोमा देन? हेमेटोमा कहाँ आता है? हेमेटोमा बीच में आता है, हेमेटोमा आखिरी में आता है। पैनकेक, व्हाट डू यू थिंक? डॉक्टर एंड कैफीन, इतने सारे लोग बैठे हैं, आंसर 2 लोग कर रहे हैं, वेरी गुड। इन 2 का तो पक्का होगा वैसे। डॉक्टर ताराकांता दास, ओके, पेटिके परप्यूरा इकाइमोसिस हेमेटोमा। Pettike, you say, then you say purpura, okay. Nandu says pettike, then purpura, then ecchymosis. Okay, pancake kind. Pettike, she says, then she says purpura, then she says ecchymosis, and then she says hematoma. Okay, last में hematoma होता है. Okay, let's see. So of course, the tiny microvascular bleeds, this microvascular hemorrhages, these are small pettike's. These all are small pettike's. इससे बड़ा क्या होता है? इससे बड़ा होता है purpura. इससे बड़ा क्या होता है? ये है परप्यूरा। आई गिव यू पहले तो चलो फिनिश करते हैं। सो पेटिके, दिस इज पेटिके, उससे बड़ा परप्यूरा, उससे बड़ा इकाइमोसिस, उससे बड़ा हेमेटोमा। ओके, आर यू अंडरस्टैंडिंग? सी, दिस अ वेरी ब्यूटीफुल, बड़ी मेहनत से मैंने बनाया ये स्लाइड्स एक एक चीज़ को फोटो में दिखाने के लिए। पेटिकेज आर द स्मॉलेस्ट, दिस टाइनी माइक्रोवैस्कुलर हेमरेजेस बेसिकली आर द पेटिकेज। ओके, like you know, in dengue fever also we have positive tourniquet test, right? There also you see the peticase in 1 centimeter square inch area. So Dvivedi Atmesh, PPCH. Okay, peticase, then we have purpura, then we have ecchymosis. Very beautiful picture, please remember this, ठीक है? Doctor and caffeine says, I had exact hematoma after football match. So this one very good. So this is nothing. सबसे बड़ा, so ये this leg is of doctor and caffeine. So सबसे बड़ा क्या होता है? सबसे बड़ा है hematoma. याद रखना please. Sometimes see you forget the size. Okay, so raccoon eyes is different. Yeah, where do you see raccoon eyes? Where do you see raccoon eyes? Which blastoma? Where do you see raccoon eyes? Raccoon, वो इसको ऐसा दिखता है करके raccoon eyes. Anyone? Pancake, where do you see raccoon eyes? Do you see any tumor? Any problem? Do you see raccoon eyes? It's an exam question. Who will tell me? Anyone? Yogi Mahendra, hello sir, good evening sir. Very good. So I'll repeat again. Number 1 is peticase, then we have purpura, then we have ecchymosis, and then we have hematoma. Okay, very good. And one more thing, if I say palpable purpura, in my lower limbs, what is the differential diagnosis? What is the best differential diagnosis? I'll give you a Ferrero Rocher. If you can tell me, where do you see what you call, if I say palpable purpura only in my lower limbs, what is the answer? There's only one most important differential diagnosis is, very good, Hinong Shonlin purpura. Okay, Hinong Shonlin purpura has been 2 years. Say it is a NEET PG question. Palpable purpura in my buttocks and lower limbs. Palpable purpura in my buttocks and lower limbs. HSP Hinong Shonlin purpura. And yes, raccoon eyes is seen in neuroblastoma. ठीक है? Okay, pancake, I'll give you chocolate. Once we meet, I'll give you a Ferrero Rocher. ठीक है? No problem. So raccoon eyes is seen in neuroblastoma. Done? Okay. So that's what. So now can we appreciate that as a functions of vitamin C, I got what? Because my vitamin C was deficient, my bone was very weak. Once my bone was very weak, because of increased capillary permeability, like my bone started bleeding out, leading to subperiosteal hemorrhage. And there was also bleeding in my body, in my skin, leading to petechiae, purpura, ecchymosis, and hematoma, right? And that will lead to very, very important point, swelling of the thigh. Yes or no? Swelling of the thigh, very importantly. Yes, very good. And then, yeah, very good. So pancake, yes bro. Palpebral purpura, abdominal pain, joint pain, and also hematuria. You forgot pancake, hematuria. It's a tetrad. there's a tetrad of HSP. अगर पढ़ना ही है तो मतलब टॉपिक खत्म नहीं होगा, मैं ऐसे ही बोल देता हूँ. टेट्राड होता है HSP का. There is a IgA deposition in my joints leading to arthritis. There is IgA deposition in my skin leading to palpable purpura. There is a IgA deposition in my GIT leading to postprandial bowel angina, and there is a IgA deposition in my kidneys leading to hematuria. So we have a tetrad of in HSP. Okay, so in vitamin C deficiency, will I have swelling of thighs? Definitely. Will I have extreme restriction of movements? Is this line true or false? Yes, of course, sir. If you have a swelling of the thigh, then you can have, what you called extreme restriction of movements, and that will lead to pseudo paralysis. That is a very, very important point. Osama Sheikh, bro, did you understand? Yes or no? You were asking. So this is one reason why a patient of what you call itna pain hoga, itna swelling hoga, that the patient will lead to what you called pseudo paralysis. Pseudo paralysis the patient will have, and because of epiphyseal displacement, itna wo ho jata hai that epiphyseal displacement ho jata hai. Okay, epiphyseal. What is epiphysis? Let me make a bone diagram. So okay, A, B, C. Which is epiphysis? कौन बताएगा? ओसामा, इसमें से epiphysis क्या है? Is A is the epiphysis? Is B is the epiphysis? or C is the epiphysis? Who will tell me? Doctor says वो ऊपर वाला. कौन से ऊपर वाला? इधर भगवान ऊपर, मेरे छत के ऊपर. आई लिव इन सेकंड फ्लोर, फोर्थ फ्लोर. यूर सेइंग वो ऊपर वाला. कौन सा ऊपर वाला? हाँ जी, एग्जैक्टली, वेरी गुड. क्या मैं, हाँ ठीक है, वेरी ट्रू. सो वी ऑल नो दैट, या दिस वन. सो वी हैव द डायफाइसिस ऑफ कोर्स, देन वी हैव द एपीफाइसिस, एंड देन वी हैव द मेटाफाइसिस. सो दिस पार्ट इज द डायफाइसिस, ऊपर वाला इज द एपीफाइसिस, एंड दिस पार्ट ये जो मिडल में है, दिस पार्ट इज द मेटाफाइसिस. डी डायफाइसिस, या सी इज, हाँ वेरी गुड, समझ में आ गया ना, ये वाला पार्ट है. ओके, लेट्स गो बैक अगेन. सो दैट्स इट, एंड दैट लीड्स टू pseudo paralysis because of epiphyseal displacement. And also there is a fragmentation of the calcified matrix. पूरा फट जाता है, मतलब फ्रेगमेंटेशन, चकनाचूर हो जाता है. जैसे किसी का दिल चकनाचूर होता है ब्रेकअप के बाद, ऐसे ही होता है फ्रेगमेंटेशन ऑफ द calcified matrix. Okay, and that's it. And what happens later during healing? No, these hematomas, basically they can become calcified during the healing phase. That all the hemorrhages and traumas which are happening, they can lead to, it can become calcified. Okay, that's what. And that calcification is known as dumbbell shape calcification. Again, a PG entrance question: where do you see dumbbell shape calcification? The answer is vitamin C deficiency. See, vitamin C deficiency will bleed out. Once it bleed out, it will lead to hematoma, and hematoma, when it starts to heal, it becomes calcified. And that is known as dumbbell shape calcification. Osama says, sir, जब दिल चकनाचूर होता है तो जिंदा कैसे रहता है इंसान? रहना पड़ता है, लाइफ है, और रहना पड़ता है, ज़रूरी भी है. ठीक है. So that's what. So vitamin C deficiency, if I am having vitamin C deficiency, I will have bleeding of gums. All my bony parts are having hemorrhages. Okay, I'm having swelling of thighs, swelling of, basically not thighs, joints basically. And also what you called defective dentition I will have, very importantly. I might lose my teeth also, again very important. And it will basically, see, it will be affecting the epiphysis and the shaft bones. It will be affecting the epiphysis also and the shaft. This whole thing is the shaft center part. So yeah, exactly. Yes, Saban. So that's it. And so that's why, once, see, again, understand the concept. Okay, understand, घुस जाओ टॉपिक में, ऐसे इस टॉपिक के अंदर गोते खाओ कि तुम्हें एक एक लाइन, like you know, like I always, you know, if you can feel me, like I always sit inside a topic, and I'm like, I'm inside the scurvy, and I'm looking at the bone, I'm looking at the bleedings, I'm looking at the chondroitin sulfate packet, I'm looking at everything. So sit inside the topic and cover everything as if you are surrounded with the whole vitamin C around you. It's like this, okay? And that's how you'll always finish the topic. So yes, थक गया मैं. it involves the epiphysis and the shaft of the bones. That become rare fraction. It will become rare fraction. What is rare fraction matlab, sir? Nothing but kind of a ground glass appearance. जब दिल चकनाचूर हो जाता है तो ऐसा बिल्कुल 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 ऐसा लगता है जैसे किसी ने बहुत सारे सुई धागे से पियर्स कर दिया हो. सो लाइक अ ग्राउंड ग्लास अपीयरेंस, लाइक अ वाइट आउट, लाइक अ ग्राउंड ग्लास, कुछ है ही नहीं टाइप्स, लाइक अ ग्राउंड ग्लास अपीयरेंस. ठीक है, दैट यू शुड नो. ओके. Hmm. Okay. Sounds good. So, okay, and that will lead to because of the osteoporosis is happening. That's it. And that what does that mean? Osteoporosis, matlab that's what the density and volume of the bone. The density and the volume of the bone is decreased. It is bone is decreased. Okay, that's it. And that's what. And also remember one very important point that calcification at the cartilage matrix is not hampered. ये जो cartilage matrix है ना, cartilage का matrix, उसमें कोई problem नहीं होती. Calcification at the cartilage matrix is not hampered. And that's it. And very very important X-ray picture. What are the signs you will see? So ये तीन signs तो आपको learn ही करने हैं. We have Wimberger sign, we have white line of Frankel, and we have Pelkin's fracture. Straight away this one what you called straight away exam question. Wimberger sign कहाँ मिलता है, white line of Frankel कहाँ होता है, और Pelkin's fracture कहाँ होता है. डॉक्टर प्रिस्टीन गांजा, यू ऑलवेज से ऑलवेज अप्रिशिएट योर बार्बर. मुझे लाइन कभी समझ में नहीं आई. ऑलवेज अप्रिशिएट योर बार्बर मतलब व्हाट इज द कनेक्शन ब्रो? आई एम नॉट गेटिंग व्हाट इज द कनेक्शन. अच्छा, पैनकेक विम बर्गर कहीं और भी आता है ना. विम बर्गर साइन इज सीन इन स्कर्वी, एंड विम बर्गर समथिंग है पैनकेक सिफिलिस से, मुझे याद नहीं आ रहा. डू यू रिमेंबर? विम बर्गर दो जगह आता है. एक तो विम बर्गर साइन होता है जो हमारे स्कर्वी में आता है, एक विम विम बर्गर समथिंग कुछ आता है ना. एनी एनी आइडिया? नहीं बट नहीं अरे ऐसे बोलते नहीं. सावन ही इज गंजा, उसका सरनेम है गंजा शायद. ऐसे क्यों बोलता है तू गंजा गंजा पागल. हाँ, कंजेनाइटल सिफिलिस में क्या होता है? विमबर्गर साइन तो वी हैव विमबर्गर साइन इज सीन इन स्कर्वी, एंड विमबर्गर व्हाट यू सीन इन सिफिलिस. और पैनकेक पढ़ के बताना मुझे एक बार. ठीक है. यस सर, मेन्यू में आता है. मेन्यू में कौन सा मेन्यू में? ठीक है, डन. White line of Frankel done. It's the zone of provisional calcification. So ये जो यहाँ पे calcification है, this is the zone of calcification. Okay, so that's what white line of Frankel. Okay, and because the bone becomes very brittle, the bones become very brittle. Okay, and it's very prone to fracture. That's it. Fracture or fissuring you can say, है ना. And that's why, and even epiphyseal separation भी हो सकता है. Very very beautiful. So this is diphysis, no, epiphysis and metaphysis. So can we appreciate कि epiphyseal separation भी हो सकता है. So important. इतना प्रॉब्लम हो रहा है वहाँ पे कि epiphyseal separation भी हो सकता है. ठीक है. पैनकेक सेज या सर इन सीन इन सिफिलिस. नहीं, विमबर्गर साइन इज सीन इन स्कर्वी. कुछ है विमबर्गर, आई डोंट नो, विमबर्गर नॉट टेस्ट बट विमबर्गर समथिंग, इट इज सीन इन सिफिलिस ऑल्सो. पैनकेक पढ़ के बताना मेरे को. ठीक है. That's it. That finishes the topic. So patient को क्या क्या होगा? सब conjunctival hemorrhage हो सकता है patient को. Yes, this everyone knows about it. Can anyone mention it? What is this? कौन बताएगा? Let's finish this topic. हाँ जी, सावन गले लगो भाई. ठीक है. हाँ, you may have transplant. Acha, okay, fine, got it. So this is nothing but scorbiotic rosary. Please remember, we have something known as rachitic rosary and we have something known as scorbitic rosary. Rachitic rosary is because of vitamin D deficiency, whereas scorbiotic rosary is because of vitamin C deficiency. Rachitic rosary is painless, whereas scorbiotic rosary it is painful. This one, the beaded appearance, ये जो गोल गोल हैं ये सारे के सारे, the beaded appearance at the costochondral junction, ये costochondral junction, the beaded appearance at the costochondral junction will lead to the sign known as scorbiotic rosary or rachitic rosary. Scorbiotic rosary is because of vitamin C deficiency, rachitic rosary is because of vitamin D deficiency. Scorbiotic rosary is painful, rachitic rosary is painless. And the scorbiotic rosary, this bead, no, this ये गोल गोल जो bead हैं, they are rounded. These beads are rounded, whereas in rachitic rosary, in rachitic rosary they are rounded, and in scorbiotic rosary they are pointed. That is why they are painful. Done. So clinical features are over. Everyone knows the patient will be irritable. The patient will have fever, of course, very importantly, and petechiae, purpura, ecchymosis, and bleeding, Yes, now very good question. Very good question. Yeah, Himal says scurvy means pain, which is the most common presentation. So this last point, this topic is over. 1 minute more, then we are finishing this topic. Which is the most common presentation of scurvy in a child? एक बच्चे एक माँ क्या बताएगी? Which is the most common? बस 5 मिनट हो गया. Which is the most common presentation of scurvy in a child? What you called? Okay, I name Pristine as most people associate me with happy ganja. Okay, cool, cool. Gum bleed के अलावा gum bleed तो हम सब जानते हैं. Give me some smart answer. Mother gives a history. Again, I'm telling you, it's a very good question. Please, please come out of something. Bleeding नहीं, कुछ और कुछ और कुछ और. Bleeding कम सबको होता है, adults में होते हैं. Mother gives a history. Doctor, my baby, when I do this, baby does that, and as a doctor, I will say, I think it's scurvy. सूडो पैरालिसिस नो, ये भी हमको पता है. गम ब्लीडिंग, सूडो पैरालिसिस, आई एग्री, इट्स सेपरेट. बट कुछ और, वी आर मिसिंग समथिंग, वी आर मिसिंग समथिंग. पेन. अच्छा मान लो कैसे 6 महीने का बच्चा तुमको पेन बताएगा पैनकेक. 6 months बेबी विल टेल यू मम्मा आई एम हैविंग पेन हियर. Something else, like how pain, how the mother will get to know, how mother will get to know. It's a very important point. Anyone, pseudo paralysis हो चुका है, gum bleeding हो चुका है, pain. अच्छा हिंट, हिंट तो आओ तुम्हें हिंट देता हूँ. सो 11th March को मेरा बर्थडे है. सो आई एम प्लानिंग, आई विल गो आउट समवेयर विद माई फैमिली एंड वन डे बिफोर मी एंड माई वाइफ ऑल्सो विल गो टू अ नाइस 5 star होटल. ये हिंट है. अब बताओ क्या होगा, क्या है आंसर इसका? सो यस, exactly, exactly. I think who said the right answer? Exactly. Pancake is right. Pancake is very right. So again, okay, it's a very important question. Examiner तुम्हें इसी में घुमा देगा. Examiner तुमको बोलेगा such a basic thing you don't know. You are giving NEET PG. You don't know this basic thing. ऐसा examiner will humiliate you. The most common presentation of scurvy in a child. How the mother will tell you, and you will say by counseling itself, this is scurvy. The mother gives a history. Most importantly, baby screams while changing the diaper. Very good, Pancake. I'm so proud of you. You will be a wonderful physician one day. So, baby screams while changing the diaper. Number one, very, very, very important, very important, very important. Okay, baby screams while changing the diaper. Second, baby screams while picked up. Baby screams while picked up. Baby screams while bathing. So cutie pie, cutie, cutie, a big heart. Cute, cute, cute. Okay. Okay. So baby screams while bathing, and that's what baby screams while bathing, baby screams while picked up, baby screams while changing diaper. So no one said this answer, only Pancake told. Mother क्या बोलेगी? डॉक्टर जब मैं इसको नहलाती हूँ तो बहुत रोता है, जब डायपर चेंज करती हूँ तो बहुत रोता है, जब इसको उठाते हैं बच्चे को, मदर ने उठाया बच्चा इतना रोता है, इतना रोता है. Because vitamin C deficiency is a excruciatingly painful problem. Are you understanding? So you need to pick it up. See, that's what, bro, your eyes can't see what your brain doesn't know. Your eyes can't see what your brain doesn't know. Mother gives a history. डॉक्टर इसको उठाती हूँ, देखो कितना रो रहा है. इसको मैं जब भी नहलाती हूँ तो नहाता ही नहीं है, रोता रहता है, रोता रहता है. सो समझ में नहीं आएगा. यू विल से हर बच्चा रोता है, उसमें बड़ी बात क्या है? हर मैडम हर बच्चा रोता है, बुखार है बच्चा रोएगा ही. नो, यू नीड टू पिक अप. इट्स स्कर्वी. ओके, डन, अंडरस्टूड, यस और नो? ठीक है, डन, दैट्स इट. So patient will have swelling of thighs. Very important. The patient will have a position known as pithed frog. Pithed frog. What is this position known as? The baby will be in a frog-like position. Again, so important, so important, so important. ठीक है, every word is important. हाँ, टेप लगा दो मुंह पर. किसके टेप लगा दो मुंह पे? मेरे. So frog like position, ठीक है, frog like position, ठीक है. And how do you diagnose vitamin C deficiency? Clinically, of course, you will diagnose. Radiologically, of course, you will diagnose. And what is the normal vitamin C levels in the blood? The normal vitamin C levels in the blood is 0.4 to 1.4 milligram per DL. Okay, we have to end this topic now because my mom is calling. So 0.4 to 1.4 what you called mg per DL. That's what. ठीक है, बच्चे के मुंह पे टेप नहीं लगाते, गंदी बात. बच्चा रोएगा, परेशान होगा, ठीक है. एंड लेस देन 0.1 mg per DL. If my vitamin C in my blood is less than 0.1 milligram per DL, you will say I am having scurvy. Okay, I am having scurvy. That's what, and everyone knows about pencil thin cortex. बिल्कुल पेंसिल की तरह एकदम पेंसिल जैसे मैंने मारी हुई ऐसा लगेगा. विमबर्गर साइन वेरी इंपॉर्टेंट. वाइट लाइन ऑफ फ्रैंकल वेरी इंपॉर्टेंट. पेल्किंस फ्रैक्चर वेरी इंपॉर्टेंट. एपीफाइजल सेपरेशन सो इंपॉर्टेंट. ठीक है. Okay, and this what are the differential diagnosis of swelling and pseudo paralysis? This also we have done about pseudo paralysis and swelling. Other than okay, I will ask you this. Everything I want, see whatever knowledge I have, my only intention in this birth is to transmit my knowledge, whatever you have. Okay, God has given me sound knowledge. I want you also to have a double sound knowledge. So what is the answer for this question? What are the differential diagnoses of swelling and pseudo paralysis? Scurvy, everyone knows. Scurvy, everyone knows. All the acute flaccid paralysis, DDs, everyone knows. Other than scurvy and AFP, do we have any other differential for swelling and pseudo paralysis? Anyone? Pancake? आओ सबान वो निकालो, आंसर निकालो बेटा, आंसर निकालो. सावन, ऑल बेबीज आर गंजा. बेबीज गंजे नहीं होते, बाल होते हैं उनमें थोड़े से. ठीक है, वेरी गुड. Hemal is right. Hemophilia can present as swelling and pseudo paralysis. Can we talk about septic arthritis? Can a patient of septic arthritis can have swelling? Definitely the patient can have swelling. Yes or no? Septic arthritis, hemophilia, even different tubercular arthritis, TB, right? TB of the joints, tubercular arthritis, septic arthritis, hemophilia. These all are the, even a basic fracture. Savan is so right. Basic fracture, right? Patient can have swelling. So ये पता होना चाहिए. ये examiner पूछेगा आपसे. Examiner will ask you this. Okay, common things are common and rare things are rare. AFP is little down the line. First is scurvy, fracture, septic arthritis, tubercular arthritis, then hemophilia, then AFP. So trauma, osteomyelitis, congenital syphilis also so important. Yeah, what is the name of the joint? Pancake, I will give you two Ferrero Rocher. I'll give you two Ferrero Rocher. If you can tell me congenital syphilis में कुछ joint का एक नाम होता है. कुछ joint का एक नाम होता है. Anyone? एक जॉइंट का नाम होता है. डिफरेंशियल डायग्नोसिस ऑफ स्वेलिंग ऑफ जॉइंट. कंजेनिटल सिफिलिस में भी जॉइंट की स्वेलिंग होती है, उसका कुछ नाम होता है. पैनकेक. सर टेल ऑल्सो अबाउट द टेस्ट एट 10 PM टुडे इफ पॉसिबल. शेयर लिंक 10 PM टुडे. अच्छा हाँ, आज 11 थी ना. हो गया मेरा, हो गया खत्म, तो बंद हो गया, आ गया मैं. सो व्हाट यू कॉल्ड क्लटन्स जॉइंट. क्लटन्स जॉइंट होता है. क्लटन्स जॉइंट, ठीक है. क्लटन्स जॉइंट होता है बेसिकली. हिंट मतलब हिंट ही ब्रो, क्लटन्स जॉइंट होता है. ठीक है, that finishes the topic. Treatment is vitamin C, 100 to 200 mg per day for 3 months, and oral or IV. The better is to give me oral is better. ठीक है. And how much time sir my pain and swelling will reduce? एक हफ्ते में आपकी दर्द कम हो जाएगा. और रेडियोलॉजिकल सर इम्प्रूवमेंट कब होगी एक्सरे में? 1 से 2 हफ्ते लग जाएंगे उसमें. That finishes today's topic. Thank you everyone. And before leaving, remember, life is a one-time offer. Use it well. Life is a one-time offer. Use it well. And for the 11th February 10 PM wala, this one, I will share the link with you in the group. I will share the link, and you open the Unacademy app. It is there. You open the Unacademy app. It is there. Thank you. Bye bye. Already बहुत late हो गया.